If you are a brand new EMT or an EMT student, I want to share a patient story that I had last week and just stress the importance of being able to understand and recognize abnormal vital signs and a good flow of a patient assessment. So I am a brand new EMT. I work on a BLS unit in a very, very busy city. And of course, dispatch triages calls down to us and we respond to a level 3 chest pain. Now this patient presents not in a tripod position. They are not breathing heavily. They appear normal sitting down. We go ahead and start our patient assessment, really curious, asking a lot of questions, and we start assessing vital signs. So blood pressure, normal. Respirations, normal. But I noticed that the pulse rate is jumping. Pulse rate is clocking out about 189. All right, so we're still asking some questions and then it drops down to about 86. Mind you, we're BLS, so we're not using a Zoll monitor. I'm monitoring his pulse rate on our little finger pulse ox. And I watch it jump one more time, goes up 186, drops back down to 86. So I'm noticing this high, low, high, low. And before I ever attach an engine and a medic unit to a call that I could quite literally transport 7 minutes down the road, I like to contact our base hospital. Report how the patient is presenting, report the medical history that I've gotten from the patient. Turns out they do have a history of AFib and they were just hospitalized a few days prior. With the base hospital's direction, we go ahead and upgrade the call, attach an engine, attach a medic unit, and they bring out the Zoll monitor. Turns out patient is an active SVT and they transport him to the hospital. Code 10, lights and sirens. And understanding what questions to ask, when to ask them, when to upgrade, what's abnormal, what's stable, what's unstable, has really come from repetition on patient assessment. So there's two things that I use. One, to understand abnormal vital signs, stable versus unstable. You could of course use flashcards. I personally like to use ChatGPT. That's just me. Second thing that I use is MedScepter. It's an AI proctor. You can run through simulations of calls, patient assessments, and it grades you right afterwards. So you're able to fill in gaps in your assessments and save lives. So